Namaste and welcome to the next lecture of Clinical Ayurved. Myself Dr. Mayuresh Agte. Before starting today's lecture, few requests to all of you. First, please give your feedback on this lecture series and also your suggestions so I can improve this lecture series in a better way. In this lecture series, the topic we discuss, I keep in front of you my opinions or my views about that particular topic. But I will be happy if you also share your views or opinions, if any. So, I am expecting a sort of Sandhya Sambhasha, and your participation in that is always welcome. And third request, please ask your friends also to subscribe this channel Clinical Ayurved by Dr. Mayuresh Agte. So let us start with today's lecture. We were discussing clinical application of Vasa, and in that regards Shwasakasa Jwara Chardi Meha Kushta Shayapaha. This line I discussed in the half line discussed in the last lecture. When we discussed Shwas Kas Jwara Chardi, particularly Shwas Kas and Chardi, I have discussed that how to use, when to use Vasa Kvar, Vasa Ghana, Vasa Churna, etc. Now, the next important topic in this relation is in the diseases, particularly Shwas Kas Chardi, at what time you will give the selected Kalpana of Vasa. The Aushad Sevan Kal is also important to have a big relief or a fast relief. Now remember, what is the particularity of this Vyadhi, Shwas, Kas and Chardi in particular, that they have Vegavastha. So Prasattaviki Kas, there is Chardi Veg, Tamukshvas Veg. So in such cases, where there are continuous Vegavastha of the symptoms or the dosha, the Aushad Sevan Kal, which is ideal, will be Muhur Muhur. Why it is ideal? Because when you give Muhur Muhur Aushad in the mouth, it acts in all these strotas and it helps to reduce the intensity of the Vegavastha and that by symptoms of the disease in a very fast way. So, when you are going to use Shaman Chikitsa particularly in Shwas, Kas and Chardi, the ideal way to give any Kalpana, whatever it is, Vasa Gruta, Vasa Churna, Vasa with honey, what you choose, if you give it Muhur Muhur way, it helps in a very fast and better way. Now, what is the practical difficulty in giving Muhur Muhur? That if patient is going to office, he can't take medicines in the Ghruta or Muhu, sometimes it becomes tricky to the patient. So what is the solution? What is the Yukti Praman? In market, as I told last lecture, Vasa Ghana is available, or Vasa Kunkol Vati is available. So if you feel the right choice that in this patient, this Vati which is made for the chewable way, if you ask the patient that take this Vati and chew it throughout the day or as many times possible, then it also works as a Muhur Muhur, because when you are going to chew it, the action of the medicine is on the continuous way or Muhur Muhur way. So this is Yukti Praman. So in the case of Vyadhi where there is Vegavastha like Shwas, Kas, Chardi, and if you are choosing Shaman Chikitsa particularly, then Muhur Muhur Aushad Sevan Kal is indicated or will be beneficial. I am going to take the lecture on the Aushad Sevan Kal in detail in the future. So next diseases are Shwasakasa Jwara Chardi, we have completed. Meha Kusthak Shayapaha. Now Prameha, you know, it is a disease of Kapha dosh and mainly Mamsa Medha, and then other dhatus get affected. Vasa in particular is Kapha by all the way, by balancing Shita Guna, and hence in Prameha it is used by Pitta Rasa Laghu Ruksha Guna to reduce the kledha in the body. First line of action. Second important line of action is that in Prameha that is Dhatu Asarta, and because of Tikta Rasa Ruksha Guna, Vasa is useful for the to increase the intensity of Agni and particularly Dhatu Agni, and hence in Prameha along with the Kledanashan, Kafanashan, Vasa is useful for the Dhatvagni Vardhan also, and hence Prameha, in Prameha it is a very good medicine. You can use Churna if you want fast action, and also you are thinking about the Dhatvagni Vardhan, then Asavarishta Kalpana is another good choice. Meha Kushtha Shayapaha. Kushtha again we are going to take it in detail, where Raktagata Kled is useful, is increased, sorry, and because of that Raktagata Kled, increased Raktagata Kled, which is Dushit one, Varne Karma of Raktadhatu is hampered, and the skin diseases, or what we call as Kushtha, is seen. Now, just as said in Prameha, it is Kledanashan. We have seen use of Vasa in Rakta Pitta. It stops the bleeding very immediately, and hence it is named as Bishak Mata. What it indicates, what it always remember, if it is the base medicine of Rakta Pitta and it stops bleeding, logically okay, Tittara, Shita, Virya, Ruksha Guna, you will logically you can prove or you can have that thinking. But what is the another thing this sentence Vasa is the best medicine on Raktapitta indicates? It indicates that it has got an excellent Gamitva on Rakta Dhatu, and hence it is useful in the diseases, other diseases of Rakta Dhatu like Kushta. So that you also always keep in mind that if a particular Dravya is useful in the particular disease of a particular dhatu, it also indicates that diseases of that dhatu, other diseases of dhatu, and also it will be that Dravya is useful. So in Kushtha it reduces Raktagata Kleda, and that's why the symptoms of Vaivarnya, Kandu, etc. are relieved. Last one, very important, Shayapaha. As I told you, Vasa has a best Gamitva on Pranavaha Strotas, and in Kshayaro, you always Rajakshma or Kshayajakas, the Pranavaha is mainly Dushya. So, what happens? I have discussed Kshaya in previous episodes. In short, there is this is Srotas, there is Upalepa of Kaphadosh which hampers the Dhatvagni. Dhatvagni Mande is there, and because of that Dhatu are not formed properly and you will get Dhatu Kshay. So this Upalepa of Kaphadosh in the Srotasas, which will affect this Upalepa will hamper Dhatvagni action. Dhatvagni Mande will be there. As Dhatvagni Mande is there, there will be no proper transformation of Aharas into the Dhatus, and so Dhatus will not be formed, resulting into Dhatu Kshay. So what is the use of the Vasa here? Again, it is Kafagna, so it's a very good Kafagna. So Upalep of the Kafadosh will be relieved. By Tiktarasa Ruksha Guna, it is Dhatvagni Vardhan. So Dhatvagni Vardhan will be achieved, and after these two steps are achieved, automatically Dhatu Utpatti will be restored. So in the Kshaya, Vasa acts by these both ways. Again, Vish Kalpana is better, warm water okay. Asarishta again good, because Srutasara Sukshma and Asarishta Kalpana will reach these Srotas and relieve reduce the upalep very fast. So in Kshaya you can use Vasa for this Kafagna and Dhatuni Vardhan action, and Asarishta Kalpana will be a better choice to have a fast action. I have taken 2-3 drugs so far, and I hope the clinical application of Dravya I have uh, expressed in front of you by many ways, one by Shlok, one by Gana, Charvutta Gana, and this one other by again by Shloka. Hope you have liked this and understand this. I will be eager to read your comments. We will meet in the next lecture. Thank you very much.